Hi all. Today we are going to see about diabetes. As we all know, diabetes is one of the most common disorders of modern generation, isn't it? So let us see about diabetes. We can define diabetes as a metabolic disorder characterized by hyperglycemia resulting in inappropriate insulin secretion, its action, or both. So, as the definition goes, we can understand that it is a metabolic disorder. So, something is happening to the metabolic function of carbohydrates and which result in increased blood sugar level. That is, in our body, the insulin controls the blood sugar level. So, in a diabetic patient, what happens is that the amount of insulin produced is either insufficient or lack of insulin or maybe both. So, since insulin is not produced in adequate amount, what happens is that the amount of sugar in our blood rises, resulting in hyperglycemia and thereby leading to diabetes. Now, let us see what are the different types of diabetes. We can classify diabetes under mainly three headings: type 1, type 2, and gestational diabetes. Type 1 diabetes is also called as juvenile onset diabetes. That is, it begins at an early stage. Juvenile onset diabetes which begins at an early stage of our life. And in this case, the beta cells are completely damaged, maybe due to any genetic makeup, which result in lack of production of insulin, and the only treatment option is to take insulin. Now, in case of type 2 diabetes, this is the most common type of diabetes, and what happens is that the insulin is produced by beta cells of pancreas, but it may not be in sufficient quantity to meet the requirement of body. So the blood sugar level continues to rise up. And the main treatment option for type 2 diabetes are by taking oral hypoglycemic agent. Gestational diabetes occurs when a lady is pregnant. Mainly in pregnant women, gestational diabetes are seen. Now, what are the risk factors associated with diabetes? We can say the causes of diabetes as the lifestyle changes. In the modern life, we are all addicted to junk food, and unhealthy eating habits, etc., can lead to obesity, can make the patient obese, which result in diabetes. Then any other underlying diseases like hypertension, hyperlipidemia, etc., can also lead to diabetes. Then lack of physical activity, exercise, etc., also lead to clumping up of blood sugar, which result in diabetes. Now, polycystic ovary syndrome is also another factor which can lead to diabetes. Along with that, increased consumption of alcohol, sedentary lifestyle, as I mentioned earlier, etc., also lead to cause diabetes. Now, what are symptoms of diabetes? We can mainly categorize symptoms under three headings, that is polyphagia, polydipsia, and polyuria. Polyphagia means the person always feels hungry. Now, polydipsia means always thirsty, increased thirst. Now, polyuria means increased urination. These are the main symptoms of diabetes: polyphagia, polydipsia, and polyuria. And in addition to that, there are other symptoms like vaginal infection, numbness or tingling on hands and feet. Then the wounds are difficult to heal. Then sudden weight loss can be seen in some people. Then the diabetic patient always feels tired. Also, these also are the symptoms of diabetes. Now, what is the diagnostic option for diabetes? The diagnosis of diabetes can be done by performing following tests. That is, first one, random blood sugar test. Random blood sugar test. In this test, randomly we are taking the sample and analyzing the blood sugar level. And this can be performed by using a glucometer. And if the value is greater than 200 mg per deciliter, we can say that the patient is diabetic. Now, fasting blood sugar. In fasting blood sugar test, the person is asked to fast for 8 to 12 hours before doing the test, and after 8 to 12 hours the sample of blood is withdrawn and it is analyzed, and after that the value is noted, and if the fasting blood sugar level is less than 100 mg per deciliter, the person is said to be normal, and if it is greater than 125, the person is diabetic, and if it lies between 100 to 125, the person is said to be pre-diabetic. Now, oral glucose tolerance test. This test is mainly carried out in pregnant ladies, where a glass of glucose is given for drinking and the blood sugar level is analyzed after 2 hours. And if the value falls less than 140 mg per deciliter, it is normal blood sugar, and if it is greater than 200, the person is said to be diabetic. Now, HbA1c test, that is glycosylated hemoglobin test. In this test, we are measuring the glucose which is attached to the hemoglobin, that is glycohemoglobin is measured. This test helps to know the value of blood sugar for last 3 months. That is, here we are measuring the sugar connected to the RBC. As we all know, the lifespan of an RBC is for 120 days. So, by analyzing this, we can get the value of sugar range for the last 3 months. That is HbA1c test, which gives most appropriate values. Now, next one is urine analysis. By performing urine analysis also we can check diabetes. That is analyzing the urine, and if we find that ketone bodies are present, it can lead to diabetes. Now, as we have mentioned earlier, the only treatment option for type 1 diabetes is by taking insulin. So, which all are the spot at which we can take the insulin? That is maybe from the abdomen region, that is the front sides of the abdomen, or in buttocks region, then thigh region, and upper and outer arm region, etc. We can see the figure. Now, what are the different types of insulin? There are mainly 4 types of insulin, that is rapid acting insulin, short acting insulin, intermediate acting insulin, and long acting insulin. In rapid acting insulin, it acts within 15 minutes, and the duration can be prolonged up to 3 to 4 hours. Whereas in short acting insulin, it acts within 30 minutes and the duration extends up to 6 to 8 hours. In case of intermediate acting, it takes 1 to 2 hours for action, but the duration is for 12 to 18 hours. And in case of long acting insulin like protamine zinc, it takes few hours for action and extended period for 24 hours. Now, what are the oral anti-diabetic agents for type 2 diabetes? Mainly sulfonylureas, biguanides, alpha-glucosidase inhibitors, and thiazolidine diones. In sulfonylureas, what they do is that they stimulate the beta cell of pancreas, thereby to secrete insulin, which improve the binding of insulin to the insulin receptors. The example of sulfonylureas include tolbutamide, glipizide, glimepiride, glibenclamide, etc. Now, biguanide, the most common one is metformin. Metformin increases the tissue sensitivity to insulin and thereby increasing glucose uptake. Now, alpha-glucosidase inhibitors like acarbose, meglitol, etc. delays the absorption of glucose in the intestine. Next one is thiazolidine diones like rosiglitazone, pioglitazone enhance insulin action at the receptor sites. In the diagram, we can see that the alpha-glucosidase inhibitors act on the intestine, thereby reducing the glucose absorption. Then biguanides and thiazolidine diones are acting on liver, thereby decreasing the hepatic glucose output as well as increasing peripheral glucose uptake. Then sulfonylurea and meglitinide increase the insulin secretion from pancreas. The main drawback with sulfonylureas is that they result in hyperglycemia. That is, hypoglycemia means there is a sudden depletion in level of blood sugar which may result in fainting of the patient. So this is the main drawback for sulfonylurea. In case of biguanides, there is no hypoglycemia, but it causes certain GI irritations. Now, what are the complications associated with diabetes? Diabetic retinopathy. That is, in a diabetic patient, if the blood sugar levels goes uncontrolled, what happens is that it results in diabetic retinopathy affecting the eyes and his vision gets affected. Then there are other complications like diabetic ketopathy, diabetic nephropathy, etc. So in a diabetic patient, it is always important to control the blood sugar level and to have a continuous monitoring of blood sugar level. Thank you.